Hi there. That's called being surprised coming back, and I wasn't paying attention. Now let's get to it, okay? 1, 2, 3. Those long and tedious hours spent in a doctor's office, your life and patience ebbing away because your appointment time was 2 hours ago, the anchor's not paying attention, all that may soon be coming to an end, which could make plenty of people happy, but when others hear about how this will happen, they may not be so giddy about another science fiction intrusion into their lives. Take a deep breath. I'm back with you now. Let out all those pastries you've consumed today. Welcome back to MidPoint. The deputy health editor here at Newsmax, Nick Tate, joins us. Have you had any of those pastries in the bag?
That's for me to know and for you to investigate.
You didn't have any arugula, brother. You're out of here, man. You got to have it every time when holidays come around. Let's go ahead and start with this whole computers and doctors here, because it's talked about computers replacing doctors. All right, look, I know that there's already computers here, but are we moving to the science fiction age where basically somebody will finally be able to go up to the monitor, put their hands down and say, diagnose me?
We're close, but not quite there. I mean, what's happening is that we are in an era of digital medicine, actually just prior to the era of digital medicine. Where I think we are today is where we were with digital music back in the mid-90s before iTunes and the iPod and the iPhone came out, in that there are so many resources that are available, computer databases that allow you to get a blood test. You can now go to Walgreens and get a blood test. There are companies that will let you do this, and the results from that test without a doctor being involved may tell you more than you will get from the doctor's office.
Are we getting to the point, though, and again, I know I'm talking about science fiction, where you'd be able to put your finger down on a pad, pricks, gets a little piece of blood, it takes it, the doctor looks at it, and the doctor's 3,000 miles away and is able to diagnose within 10 minutes?
The answer is yes for certain conditions. I mean, if you're talking about cholesterol, you're talking about blood sugar, they can do that right now. There are 2 or 3 companies that are able to do it. There's even a company out there called 23andMe that will do a genetic makeup, complete map of your genetic system, and they will tell you what you may be at risk for certain kinds of cancer and diseases. Now, the concern, of course, is if these tests are done completely independently of a doctor or health professional, you won't know how to interpret them, and there are other issues that are raised, medical ethics issues, for instance. Is it a smart thing to get a test for, say, cancer or even HIV, find out the results in your home where there isn't a physician or a nurse or a physician's assistant to tell you, well, here's what this means, this is what your options are, this is what your treatment is. So we're not yet at the point where it's self-diagnosing medicine using computers, but the technology exists to help people who are not maybe physicians. We're talking about nurses, we're talking about physicians' assistants who are more likely to be in that situation with you in the years ahead with those diagnoses, with some assistance from computer software.
Are we getting to that out of necessity? Because you and I have talked about here with regard to Obamacare, we've seen the number of doctors falling drastically around the country, fewer doctors in schools now, so we're going to have, instead of 1 doctor for 20 people, 1 doctor for 200 people eventually, out of necessity.
That's what's driving it, is shortages plus costs. And the truth is that there are some upsides. I mean, if you can disassociate yourself from this idea that it's, a robotic doctor like the robot on Lost in Space, Danger Will Robinson, remember that guy? It's not,
Robbie.
Robbie, good. It's not quite that, but we are getting to the point where, as I say, digital medicine is informing what's happening with you in a doctor's office, or more likely with a nurse or physician's assistants. There are some upsides. You can get the information more quickly. You don't have to wait hours to see a doctor. And in some cases, you get more information than a doctor will provide from a blood test. And you can then take that information and work with a health professional to say, okay, what do I do? How do I change my lifestyle to reduce the risk for these things that my blood test has told me I'm at risk for?
Cuts down time in the waiting room. I'm a happy human being, and so are many other people. All right, also in health with regard to life and living longer, ibuprofen, adding 12 years, this has got to be an average, adding 12 average years to a lifespan, that's incredible.
That's correct. What has happened is researchers at Texas A&M University looked at the benefits of Advil. Now, we know that aspirin is an anti-inflammatory. Aspirin is used as a preventive for heart disease, and in some cases to prevent certain kinds of cancer. They've now expanded it, and the research suggests that even ibuprofen, Aleve, those kinds of substances can also prolong life. They're not quite sure why. They think it may have to do with inflammation. Inflammation is tied to heart disease, diabetes, Alzheimer's, but they also believe that there may be, ibuprofen may interfere with the way that cells take up tryptophan in the body, and so that may have a kind of life-enhancing, life-expansion capability. Now, the advisory on this is most of the research has been done in animals, so they're now looking to track people and see if they see the same benefits.
What about then taking an aspirin and an ibuprofen together? Because a lot of people I know take the aspirin right now.
I think the big picture is that you don't need to worry about the dangers, and there may be a benefit. The problem is that, like with aspirin, Ibuprofen, you can get too much of it if you're taking a lot of it, and it can be tough on the liver, particularly if it's combined with alcohol. So again, with anything, even if it's aspirin, even if it's Advil, even if it's Aleve or ibuprofen, you want to talk to your doctor or a nurse practitioner, as the case may be, to say, how much should I be taking, how much is safe, how much might put me at risk.
Don't go running out and taking an ibuprofen right now. Check with your doctor, make sure it's okay. It's
That's
still
right.
basic common sense.
The basic disclaimer, and right.
All right, basic common sense here. Getting inoculated. It seems as if some people are maybe missing that, because let's see, Angelina Jolie right now has chicken pox, I believe she's come down with.
That's
that
right.
stopped her movie promotional tour.
Correct.
And then Sidney Crosby of the Pittsburgh Penguins in the NHL has the mumps. What's going on? I thought these diseases were nearly gone.
Well, it's not even only Sydney, but it's more than a dozen NHL players that now have the mumps.
Because mumps is very contagious.
It is very contagious, since people in close quarters. A couple things are happening. First of all, people are not getting vaccines at the highest levels that they've been getting them in the past. Concern about safety, concerns about effectiveness have kept many people away. Now, the public health system is based on the idea of what's called herd immunity. What that means is if a large number of people get vaccinated, then even those people who are susceptible to mumps, measles, chickenpox won't get it, because more people have the vaccine in their system and therefore they cannot spread it. But if a large number of people are not getting the vaccine, then it increases the exposure risk, it increases the spread. The second thing is that even though we were vaccinated for these things as kids, there is some evidence that it's only 80 to 90% effective, number one, so the vaccines aren't perfect. Number two, that immunity does wear off over time. So as you get older, you might need a booster shot. So what you can do is you can go to your doctor and you can say, I need a blood test for antibodies in my system to tell me whether in fact I'm susceptible, whether I'm protected or not, and whether I need a booster shot.
30 seconds, quick flu update.
Quick flu update, it's spreading, it's big, it's hitting many places of the country. If you're traveling for this holiday in the next couple of days, there are some precautions that you're going to want to take, particularly if you're flying. You're going to want to be take hand sanitizers with you, don't touch your face with your hands, sit in the front of the plane if you can, turn those gaspers up, and the big thing is do everything you can to boost your immunity. Staying active, eat well, get plenty of rest, and try to de-stress for the holidays as you can.
And if someone coughs next to you, lock them in the bathroom.
Or get up and move.
Always a pleasure, man. Merry Christmas.
Merry
Happy New
Christmas,
Year.
man. Same
I'll
to
see
you.
you in the next year. Go get some Rugula, will you, please?
I will.
It's always
Thank
good
you
for
so much.
Trust me, that's okay. Your waistline can handle it. Breaking back with another prediction from T. Boone Pickens regarding the price of oil. And another moment of reality in the burgeoning war between America and North Korea. Cheryl Atkinson joins us, and much more as MidPoint continues.